We enter into Holy Week, and I wanted to wish everybody a happy Passover and a happy Easter. I'd also, my sister Joanna's birthday today, so buono compleanno, happy birthday. And on a more somber note, not only to the 4 residents who have lost their lives with COVID-19, Springfield residents, but I was saddened to hear my friend and colleague, State Representative Bud Williams, his son Kamari unfortunately passed away. Great young man, great coach, basketball coach at the High School of Science Technology, did a tremendous job with those young men on and off the court, and I'm very saddened to hear about that passing. So for all those who have lost their life with this COVID-19 here in Springfield, and especially for Kamari Williams, just have a moment of silence, please. Thank you very much. This weekend, just on the updates, we are now up to 221 in the city of Springfield that have tested positive. On a good note, with the Springfield Police Department, we are down now 24 officers, he or she. That is down from the high of 39 that we've had. The Springfield Fire Department has moved up, though. We're down 5 firefighters and 1 dispatcher that we are now down. I can't say enough about Superintendent Warwick and his team on the school side. We are well over 100,000 meals, including weekends, served to our students and families. And this week, it's unheard of in an urban center, this week, 10,000 laptops will go out to students and families. 10,000 to continue our educational process with connectivity for those households. The homeless tenting, triage, medical tenting, MASH tenting we put up, I was there Saturday morning. Unbelievable. And a lot of this work is being done by facilities management, by our own facilities management team, and Charlie Armett and his team and some other subs. Unbelievable, the 3 massive tents and state-of-the-art with heating, air conditioning, sinks, bathrooms, showers. And Helen and Pat Sullivan have done a tremendous job. Tim Sheehan, they've just done a great job, Helen and Pat. They will speak to you a little more pertaining to that, how that is going to operate. Mass Mutual, again, has reached out to me. They've been an outstanding Mass Mutual insurance company, outstanding corporate citizen, to see if they can assist us with that endeavor too, which I appreciate. Helen Caulton-Harris, my Commissioner of Health and Human Services, again, has done yeoman work with her team. She continues to monitor. Obviously, we told you about Chapin Long-Term Nursing Home, how we're working with the state DPH and our department and all the health providers to make sure that the mitigation is occurring there. She is also monitoring other areas with DPH too, so we stay on top of that. We wanted to bring relief to my taxpayers, and I'm again very happy that Governor Baker legislature's passed that legislation. So your real estate taxes will not be due May 1st. They will be due June 1st, trying to bring some type of relief. And speaking of that, TJ Plant, my CAFO, we're tracking everything. I'm bringing on board Rensselaer, the company, Josh Norman, who I used during the tornado and other natural man-made disasters here in the city of Springfield to recoup every dime for the citizens of the city of Springfield business community. But already we've spent $673,000 have been spent. And again, even though we're keeping city services going to the best of our abilities, I'm down $1 million in revenues coming in. The Echo Dev under Tim Sheehan, Chief Development Officer Tim Sheehan, our first round went out. 30 restaurants received grants, $225,000. We had nearly 90 that applied. I wish we could fund each and every one of them, but we've just finally been given okay from HUD. Tim and I will be, hopefully this week, could be midweek, another $500,000 we're going to put out there. These are grants now, unlike the feds in the state, which are low-interest loans, which if you do follow some of the requirements, you might not have to pay everything back. But these are grants, $500,000, small business grants that we're going to have going out. The criteria will be going out sometime this week. We also urge those restaurants that were unable to make the cut during this first round to reapply again. Again, I want to be able to help everybody I can within reason on the money aspect. Continue to work with my Chief of Staff, Tom Ash. We're continuing to work independently to bring in private testing aspects, which if done, we would probably do under the auspices of Helen, Caulton-Harris, in our homeless triage area there. We continue to work with Friends of the Homeless, our homeless providers. We continue to work with Bay State Medical Center and Mercy Hospital as we're staffing up. I also want to thank Superintendent Warwick. The school nurses are going to be assisting Helen, Caulton-Harris. When we call this tracing that we're going to be doing, we were able to work that out, and again to the hospitals that'll work with us on medications and some of the staffing that we're putting together with the National Guard. Again, on the face coverings, the professional masks need to stay with our first responders, our street activities, police, fire, street activities that are going on, and of course to all our medical providers that they desperately need that. So homemade masks, homemade face coverings are okay, bandana, scarves, t-shirts can be used. And again, we recommend this, especially if you're out and about. You have to go to one of the larger stores or even a smaller store, because most people are practicing social distancing, some are not. And this does not overrule all the social distancing, washing your hands constantly, and the personal hygiene and the health requirements. Business continues as usual in the city of Springfield. I'll be chairing our first school committee meeting under the Zoom aspect this Thursday evening at 6:30. The city council will have a Zoom meeting tonight, I believe, starting at 5:30. I'm very appreciative because we have to pass some financial orders and grants to keep the city moving forward, so I'm very appreciative of their efforts. Sunday, I was on the phone with our governor, Governor Charlie Baker, late Sunday afternoon, speaking to him on the ventilators to make sure that Bay State and Mercy are on the radar screen for ventilators in need. The governor also indicated to me that he might be doing something for first responders type housing too. Sheriff Nick Cochie, who's been a great partner, called me Saturday evening. As you know, he is opening up for first responders up at the Ludlow site there if they're unable to go home, and there's many corporate citizens and businesses that are going to donate to that, which would be free of charge. Helen, again, continues to monitor situations. To Tim Sheehan, thank you. Jason has been brought aboard. He's our mapping expert. Helen is going to be using that to map out the COVID-19 trends here in the city. Commissioner Clapprood will speak about police operations, continue to make some great gun arrests over the weekend. She'll also, through relationships, N95 masks are coming in with our relationship with Commissioner Gross at Boston PD and Chief Keyes and Chelsea. We're getting about 400 or 500 there. 30 National Guard are coming in under the command of Commissioner Clapprood. Sex offenders, that's still continuing on. Pearl Street, the police department, we're still registering them. They're 6 feet apart because we're going to make sure that they're toeing the line there. And I'm just trying to see any other things. Smith & Wesson is donating face shields. I know we have those coming in. Director Chris Signoli had mentioned. on that. Again, Pat Sullivan, great job with the housing, with the homeless situation. So as we move forward, I'm very, very appreciative of Dr. Kerouac, who is the president and CEO of Bay State Health Systems, and Dr. Robert Ruse, who's the chief medical officer of Mercy Hospital Trinity, that they take the time to come out here every Monday morning at 10:15 to give a specific update. They have been doing fantastic work, yeoman work on the front lines, and we're very appreciative of their rank and file and everything that they continue to do. So without further ado, let me bring up the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Thank you, Mr. Mayor. Good morning, everybody. I also want to extend my condolences to Bud Williams and his whole family for the loss of their son Kamari at such an untimely age. I also wanted to mark the loss of, excuse me, an important member of the Bay State Health family. Judy Plotkin-Goldberg passed away last week due to complications of COVID-19. She was the first ever woman chair of the board of Bay State Health and a remarkable contributor to the life of the communities of Western Mass. In compliance with the CDC guidelines and with the mayor's proclamation, as you can see, I am wearing a mask that I made in my kitchen a couple of days ago. Let me explain why I'm doing it. The CDC basically noticed that in some cases, people might be shedding virus a few days before they become sick. So I'm actually wearing this to protect you, because I don't know if I'm going to get sick in a few days and I could be shedding virus right now. I'm not doing it to protect me. So it really is a sign of trying to take care of folks in our community. I'm also mindful to the mayor's comments of not depleting the stock of the standard issue surgical masks that we have for our healthcare workers at Bay State. And so I've devised this rather primitive covering. You're going to, thank you very much. You're going to see a much more professional version of that when Dr. Roos takes the podium a little later. So this is the time for any of you who are good with a needle and thread out there to start to get to work and start making masks. If you go to coronavirus mask pattern, if you Google that, you'll see some free patterns that you could actually use to make masks. Now, it's important that we remember that this does not mean that we're giving up on all the other advice. This adds a little bit of a layer of protection. But the real big important messages and the major way that this infection spreads is through close personal contact. So hand washing, observing social distance, and covering your nose and mouth with a sleeve or a tissue when you cough or sneeze. That's really the biggest bang for the buck in terms of keeping this from spreading. Epidemiologists and infectious disease specialists like me look at how does a disease spread to design the defenses against it. We don't use our imaginations about what could possibly happen. And so I am not spending my time disinfecting my groceries and my vegetables at home when I come back from the supermarket, because I know that if this was a disease that was passed on through pasta boxes and bananas, it would look a lot different than what we're seeing right now. It passes on through close personal contact. Let me give you the numbers from Bay State. Thus far, we have tested 437 positives, 1,521 negatives, 118 pending, that smaller percentage of the total reflecting more rapid turnaround, for slightly over 2,000 people tested. As of yesterday, there were 121 inpatients with COVID across the Bay State system, 68 people under investigation, that is suspected cases, 43 people requiring critical care. On the good news side, about a third of the people that we have admitted with COVID infection, including many who were on mechanical ventilation, have been able to be discharged home. Which is really good news. And so there have been some wins. And so I think it's important to keep track of that. With regard to personal protective equipment, we continue to pursue multiple deals, have many irons in the fire at once. We're unfortunately bidding against other states and regions and health systems, so we're paying about 10 times what we'd normally pay. We've started to sterilize and reuse the N95 masks, and that extends their life. We've hired over 50 PPE coaches, because technique is just as important as the right equipment. And if people forget and don't use the right technique and contaminate themselves as they're taking this stuff off, it can still be a big problem. We're happy that we have not seen any spread of the disease in healthcare workers who are caring for COVID patients, which says to us that our approach is working, and we're pleased about that. We have seen employees who have acquired the disease, but they seem to have done so through the community in relation to certain community clusters. On the testing front, we are beginning testing this week up at our Holyoke Lab Center. A big thank you goes out to Governor Baker and Congressman Neal, who twisted some arms to get us the needed chemicals and swabs. What that's going to mean is we'll be able to expand the scope of our testing. Right now we're doing healthcare workers, inpatients, and first responders. We'd then like to move to people who are in congregate living situations like skilled nursing facilities, shelters, etc. And then finally to get to our patients who are suffering at home from this disease, who've been waiting a long time and are getting a little exasperated, as we are, by the inability to test more widely. We hopefully will be announcing centers for drive-through testing for ambulatory patients, and I'm hopefully be able to give you more details on that next week. In terms of the bed situation, there are roughly 500 patients in hospital beds at Bay State Medical Center today. It's important to remember that there are roughly 200 who are either COVID positive or suspected, but there's another 300 in different areas of the hospital who have all the usual stuff: trauma, heart surgery, heart attacks, obstetrics, routine pediatric care, cancer. All of that stuff is still going on, and our hospital operations people have done an incredible job moving people around and staying one step ahead of the bed need. We believe that through the use of some non-traditional hospital areas like post-op recovery areas rather than routine rooms, our usual 720-bed hospital will be as large as 840 beds. So as of today, we still have headroom for another 300 plus patients, which is important. Our hospital leaders are this morning walking through the Mass Mutual Center with the Mass Emergency Management Agency, MEMA, and it's going to be important for us to figure out how a facility in Mass Mutual fits into the puzzle here in terms of the bed situation, not only in our hospital, but all the hospitals of the region. Similarly, we're working with the owners of some skilled nursing facilities to try to build out that capacity, that is to say, patients in a nursing home setting who are COVID positive. We have, like many people, been looking at epidemiologic models. These are kind of like weather forecasting, and they can be just as inaccurate as weather forecasts sometimes are, but they do give us at least some warning about what we might be looking at. I know that there have been some publications of national models suggesting a surge or a peak in the middle part of April. What we're seeing from our Western Mass models would suggest that the peak might be a little later, sometime in May, possibly even into early June. And that's really our goal. Our goal is to do a nice slow burn here that doesn't exhaust the capacity of our hospital systems, and not to have some big explosion like they had in northern Italy and are currently having in New York, which causes the whole system to be overwhelmed. But that, which direction we go depends very much on our community and their willingness to tolerate, maybe even for longer than we expected, some of these so-called social distancing guidelines. Like the mayor, I was mindful of the fact that, this is Holy Week. Next Sunday is Easter. This week is when Passover starts. In a few weeks, it's Ramadan. I was in the grocery store yesterday getting the materials for my mask. But I also noticed that, yes, of course, there's no toilet paper and no rice, but there were loads and loads of Easter hams. loads and loads of hams for Easter dinners that were not going to happen. And it really, it was kind of a sad statement about where things are at and the fact that there are so many traditions that are being deferred or suspended right now. But I think people are showing social solidarity in spite of the so-called social distancing through internet sorts of connections and basically realizing what's important in life. And I think when this is all over, we're going to appreciate very ordinary things in a much higher level than we do now. And of course, like all pandemics, we will be changed by it. But I think in some ways we'll be changed for the better in terms of our appreciation of the things in life that really count. So, Mr. Mayor, I thank you for your leadership, and I appreciate the opportunity to share my thoughts with the community each week.
Thank you, Dr. Kerouac. And again, Dr. Kerouac and Dr. Roos will be available right after our updates for any and all questions, because I want to, obviously, they have to get back to their facilities ASAP. I also want to give a shout out to Eversource. They've been very, very good to us at the homeless triage center that we built on Wellington Street. And as Dr. Kerouac had indicated about the homemade masks, and God rest her soul, if my mom was around, she was an outstanding seamstress. She'd be pumping out those masks left and right for each and every one of you. I know she would be doing that. Again, I'm deeply appreciative that Dr. Robert Roos, the Chief Medical Officer of Mercy and Trinity, is here. It's been a partnership with Bay State and Mercy as we're all working together to make sure that each and every one of you is going to be okay. Chief Medical Officer, Mercy Hospital, Dr. Robert Roos.
Thank you, Mayor, and thank you, Commissioners, and thanks to the legislative delegation for the continued support and advocacy during this time. Last week, we talked about how this is an unprecedented and uncertain time, and as the COVID-19 pandemic evolves, that we must all continue to shift how we do things. Today, one of those things is quite obvious. As Dr. Kerouac and I and many others are wearing simple face masks in public spaces, including in meetings, even with just a few people. This is not to reduce or eliminate the importance of physical distancing or diligent hand hygiene or the isolation if one is sick, but it's rather as an addition to those efforts in order to further reduce the potential transmission of the novel coronavirus. We know for certain that there are people that are infected with the coronavirus that show no symptoms, that are able to transmit it. What we don't know is who those people are or where they may have been at a given particular moment. So at Mercy Medical Center, we've been clear all along to follow the recommendations of the Centers for Disease Control and Prevention and are now following these 3 simple recommendations. First, that all staff who are working with persons with suspected or positive COVID-19 wear the recommended appropriate personal protective equipment. Secondly, all staff that are working in clinical areas who may encounter those persons or others working in close contact wear medical-grade surgical masks. And third, that all other colleagues and all of us living in our daily lives wear face coverings or these cloth masks in public in all situations. These are the actions that can help protect the safety of our colleagues, of our patients, and of our public. This morning, as Dr. Kerouac put it, I'm wearing this mask to protect you, and you're wearing your mask to protect me. It's exactly that type of thinking, that altruism and that community togetherness that will help us combat and overcome this pandemic. And at Mercy Medical Center and throughout Trinity Health, we continue to be inspired by the actions of our colleagues as well as our local hospitals and community partners. For example, in the last week, we've seen hospitals like Holyoke Medical Center change their facilities and their operations literally over the course of a day to accept patients from the Holyoke Soldiers Home. And I want to recognize and thank our Mercy Family Life Center and its obstetricians and practitioners to be able to accept those patients that would otherwise have received care in those settings. We are partnering with Bay State Health, who is leading the effort with other Western Massachusetts hospitals to ensure that our planning and our resources, including the staffing and equipment needs amidst a surge, are adequate. And every day, members of our dedicated medical staff and nursing teams are volunteering and receiving training in new areas to be deployed on the front lines to be part of the teams caring for those persons with suspected or confirmed COVID. As the Chief Medical Officer, it's truly impressive to witness, and it's been clear to me that not only are we working together, but that we are stronger together. In terms of our daily status update for Mercy Medical Center and affiliates, we have tested now a total of 1,209 patients. We've had 274 positive test results, 747 negative, 1 indeterminate, and have 187 still pending. Those of you following along every week will notice that today's test result numbers are far higher than they had been in the past, because in the past we had been reporting numbers of only those patients tested immediately in our emergency department and in our hospitals. But now, over the course of the past week, we've been reporting daily all the tests that have been received and performed by Mercy and Life Laboratories, which includes some outpatient testing, our employee health testing, and from some other community-based outreach. The reason for that is to ensure that there's full transparency and an increased level of awareness for the status of the pandemic all throughout the greater Springfield community. In the past few days, we've made considerable progress on our efforts to bring testing in-house at Mercy Medical Center, performing our correlation and validation studies over the course of this weekend in the expectation that we'll be able to go live tomorrow or on Wednesday. Bringing this test in-house will do a few things. One, it will reduce our turnaround time to one that we can more closely control and always be under 24 hours, and in many cases closer to 8. It will also allow us to increase the number of individuals that we do test. And we're following similar guidelines with our priorities on emergency department and hospitalized patients, healthcare workers, but as of this morning, also expanding that recommendation to include individuals coming to our services from congregate settings like nursing homes, long-term care, homeless shelters, or correctional facilities. Within our facility at Mercy, we continue to see consistent numbers of patients with suspected or confirmed COVID-19, and that population is representing about 50% of our inpatients at Mercy on any given day. We've also seen the ability to discharge most patients that we have diagnosed with COVID-19. And we have plans in place to triple our capacity in the ICU from about 10 to more than 40, and increase our medical surge beds from 100 to more than 200. We continue to focus on the supply of PPE and also on a potential shortage of equipment, including ventilators if the peak projections of the surge prove to be accurate. We're grateful for the many donations, including of the expected over 1,000 N95 respirator masks from the Patriot plane, and for Governor Baker and his team for securing ventilators for the state of Massachusetts. And thank you, Mayor, and all those others to ensure that this region receives the needed supply. At Mercy and throughout Trinity Health, we continue to develop treatment recommendations with regional experts reviewing the latest evidence, and as we continue to seek approval through trials to use new meds, convalescent plasma, or ozone therapy to stay on the cutting edge. At this point, we don't yet know the peak or the length of this current pandemic. Some estimates have that starting in the next couple of weeks. Our models look to be a little bit further out. The Surgeon General of the United States stated over the weekend that this will be one of the hardest and saddest weeks for many Americans, and that this is our Pearl Harbor moment, our 9/11 moment. As a physician who's worked on the front lines of another tragic epidemic, the opiate epidemic, I intimately know loss and pain. Yet, just as strongly, I know hope and recovery and the power of what a community coming together can do. This is going to be a hard week, but it is an incredibly pivotal week. It's an incredibly pivotal week of many pivotal weeks where the actions of each of us can make the most difference over the course of this pandemic. It can be as simple as following physical distancing guidelines, washing our hands and isolating if we're sick. And as hospitals and healthcare providers, we are here to meet the needs of our community. But it's what you do today, this week, and over the course of the next few weeks that could truly change the course of history. Thank you.
Thank you, Dr. Lewis. And I know Sister Caritas is saying many, many prayers for us. I always call her the Energizer Bunny because when she gives you that bear hug, it'll straighten you right out. So hopefully she can give this COVID-19 coronavirus a hug and straighten it right out. Dr. Roos and Dr. Kerouac spoke of hope, and something that warms my heart. I see many residents Friday night when I got home later in the evening. My youngest daughter, Kiara, had made thank you hearts on the front door. I know Mr. Baker out in East Springfield and Billy of my staff, Baker, had put out whether ribbons around trees or thank yous on their front windows. And I say that because in your neighborhood is probably a grocery worker. And maybe on their off time they're taking a walk to clear their head, they can see that. Or in your neighborhood is a medical professional, a DPW worker, a police officer, a firefighter, post office, a mail carrier that comes to your door, he or she, every day. So as a nice gesture, if you can, cardboard, anything, a simple gesture out there to say thank you to all our frontline providers, whether from the hospitals, the grocery stores, the mail carriers, police, fire, DPW workers, you name it. We all live amongst each other. And that little shot in the arm, if they can see that people care, and probably even more importantly, that we're going to get through this together as one and for the better. So little gestures like that put a smile on everybody's face. So if you can do that, I deeply would appreciate that. And I know the frontline workers would deeply appreciate that. Without further ado, and she's done yeoman work, it's my Commissioner of Health and Human Services, Helen Caulton-Harris, and she will give her update. Helen, thank you.
Thank you, Mayor Sarno. Thank you to Bay State and Mercy Medical Center for your partnership. It is important that we all understand that we are in this together. March 6th, I came here and I told you, I'm sorry, I apologize.
You still look good, Helen.
Anyway, March 6th, I came here and I told you that there were 0 cases in the city of Springfield. Today, as the mayor said, we have 221 positive COVID-19 cases in the city of Springfield. Every zip code in our city is represented. So if you don't think that this virus is in your neighborhood or in our community, I remind you, every zip code in this city is represented. There were 764 new cases across the Commonwealth yesterday. 231 individuals have died. 15 new deaths were reported yesterday. It is important to recognize the modeling that's been done by some infectious disease individuals says that there could be potentially over 2,000 individuals in the Commonwealth of Massachusetts who could lose their life to this virus. So when we stand here and we say, please follow the instructions that we have put forth for prevention efforts, it is important that you do that. We do not have to reach the modeling numbers if we all do the work that's necessary. I want to just say that I'm going to give you some numbers because I'm still running into young individuals who say this does not impact them. So in the 20 to 29-year-old age category, 1,703. 30 to 39, 2,064. 40 to 49, 2,074. 50 to 59, 2,465. Those all are numbers for individuals under the age of 60. And so you can see, if you think about your age group, every age group is represented in significant numbers. Under the age of 19, 291. We are all impacted, no matter what our age, by this virus. 60 to 69, 1,735, and over 70, 2,098. It is important that we recognize. I want to also remind those stores who are not essential services, please do not allow patrons into your stores. We do have the power to shut down stores through the Board of Health. I have been given notice that there are stores that are still open who should not be. We take this extremely seriously, and we want you to take it seriously as well. I also want to just give some thank yous. The Department of Elder Affairs is doing an amazing job. They've reached out to over 3,000 of our elders, and that number was just given to me, 3,000. That is unduplicated. If you duplicate that number, it's 6,000. So I do want to thank the Department of Elder Affairs for the work that they're doing under the leadership of Sandy Federico. I also want to thank the Springfield Public School Department. I went to my office at 8 a.m. this morning, and there were 6 nurses there ready to help us with contact tracing. I am extremely appreciative of our law department and Superintendent Warwick, who put the MOU together and made this possible. April is Public Health Month. I was supposed to be standing here today at this time celebrating Public Health Month across the city of Springfield and nationally. I still want to take the opportunity to say to those public health professionals who are on the front line, thank you. Every year for 25 years, I've stood here and celebrated Public Health Month. We've given out awards to luminaries, we've given out awards to individuals who are doing outstanding work, and once again, I can tell you that public health is on the front line of intervention and prevention when it comes to COVID-19. Whether you are a community health worker, whether you are a CMA, whether you are a PA, whatever your role is in the public health system, you are very, very much needed, appreciated, and celebrated. And so thank you all public health professionals for what you are doing and what you continue to do. And this year's theme is for science, for action, for health. And that is so clear as far as COVID-19 is concerned. The science is telling you what we all need to do: social distancing, physical separation, very important. washing your hands, very important. Staying at home, very important. That's what the infectious disease doctors are telling us. That is what we need to do. It is important that the action that you take saves lives for your health and for your family's health. I am appreciative of the leadership of Mayor Sarno. I'm appreciative of the cabinet heads I work with. I'm appreciative right now of Commissioner Clapprood, who gave me a mask because I left mine in the car. And so we are definitely all in this together, and I am extremely appreciative of the support that we have all received. Thank you, Mayor Sarno.
That's why she is the elegant and eloquent Commissioner of Health and Human Services, Helen Caulton-Harris. Thank you, Helen, very much. A lot of this information we put out daily. And again, I want to make sure I get this right. www.springfield-ma.gov, G-O-V. That's very important. So daily there are updates of what is going on, what has occurred, what hasn't occurred here in the city of Springfield. Of course, you can always call my 311 center at 413-736-3111. So we're making sure we keep you apprised of the situations going on here in the city of Springfield if necessary, and we have to call a press conference, we do. You know, right now, these 10:15s on every Monday have been very well put together with all the individuals that are here, so we'll continue to do that. Schools are a big component, obviously, for the city of Springfield, and Superintendent Warwick and his team have done a tremendous job moving our system forward. We're dealing with a little hiccup right now, but that's not stopping again. Well over 100,000 meals to our student families, and probably even just as important, 10,000 laptops. Continuing education will go out this week. So without further ado, Superintendent Dan Warwick.
Thank you, Mayor. To begin with, my condolences to the Williams family for the loss of their son, Kamari. Kamari was one of our great teachers and coaches in the system, and a young man I've known for years. So, again, my thoughts and prayers are with the Williams family through this tragedy. We distributed over 20,000 meals on Friday, and beginning today, we're not only going to do breakfast and lunch, but we're also going to do dinner for our families. We've increased our distribution sites to 17 sites, again, geographically spread throughout the city. During this time, my team has put together an extensive remote learning plan, and we're going to distribute 10,000 more computers out to families. Families that can are going to pick them up at their school. Those that can't, we're going to use Vanpool with the support of the mayor to distribute those computers. So again, we're working through the connectivity issues for each family, making sure that our students will have the advantage of being on the computers. And I think through some of the most difficult and challenging economic times, with the support of the mayor and the school committee, we invested heavily in technology, both the infrastructure and the laptops, to put us in a position to do this now. And we also put a tremendous amount of effort into professional development for our teachers so that our kids will be positioned to move forward academically at this time. Again, a lot of work has been done putting together a remote learning plan, and we're going to execute that plan for our students. Again, my thoughts and prayers are with all the families, and we'll get through this together. Thank you, Mayor.
Thank you, Superintendent Warwick. On our public safety side, I'll now bring up first Police Commissioner Cheryl Clapprood. Her men and women in blue have done a tremendous job, and then I will bring up our Fire Commissioner Bernard B.J. Calvi and his rank and file. Done a tremendous job. They're still out there on the streets, keeping everybody safe and sound. So without further ado, Springfield Police Commissioner Cheryl Clapprood.
Thank you, Mayor. As the Mayor mentioned, we're good today. 24 officers are out, COVID-related illnesses. I actually have 2 officers, one did already return, one is returning today, who tested positive for COVID and have fought through it and are medically cleared to come back. So I'm starting to get officers who are cleared, actually coming back to work. They want to come back to work, they're waiting to come back to work. So I'm thankful that I had 10 positives, and I'm so thankful that all 10 of my officers had mild, if there's such a word, mild symptoms, were able to stay at home, recover at home, and were anxious to come back to work. So I'm very thankful for that. I also extend my sympathies to the Williams family. My heart goes out to them and to my friends at Bay State Health for your loss. You're in my thoughts and prayers. Another reason I'm very thankful today, and it's not a bad day for me, is as we speak, I have a sergeant coming back to 130 Pearl Street from Chelsea, Mass. And as the mayor mentioned, thank you to Commissioner Gross and Brian Keyes, the chief of Chelsea, Sergeant Fleabot, Officer Richard Bellamo, and Officer Tim Roman for being out today at the Home Depot parking lot in Chelsea and handing off some of the N95 masks that were secured by Commissioner Gross and Chief Keyes. So thank you so much to Chelsea and those guys. Like this small group here that I meet with every day, and we're coming together as a team here, the law enforcement team is coming together, and I hear daily from Chief Keyes about ideas and protocols, and we're sharing back and forth some information on what works and what hasn't, so I'm grateful to that. I will meet at noontime with the National Guard again. I've met with them Friday, and we'll get a good game plan for securing and taking care of the tents that have been constructed on Worthington Street across from our shelter. It's my pleasure to help out Pat Sullivan and his team and everybody else who's up there. It's just a tremendous job they did in such a short period of time. So we want to keep it secure. I know it's important to people who are in shelters. Their number one complaint why they don't use a shelter is usually security, and they don't feel safe. So if we can do that for them and encourage them to use those sites, the better everybody is off for it. So we'll make sure that the National Guard, they've been great. They're going to have 3 shifts, and they're going to maintain the security, and I'll maintain the security around the perimeter of that facility. So I think this is a real good working relationship. I want to let you know too that during all of this, some crimes have decreased in the city of Springfield, and some have been on the uptick. I spoke about domestic violence, maybe a little uptick because everybody's home together. But they haven't let up on us on some violent crime, and the Springfield Police Department has done tremendous work. We have great progress on the Whiting Street murders. I think you'll be hearing about that shortly from Captain Duda. He's done great work on that. And over the weekend, 2 arrests that just great police work. One, yesterday afternoon, shots fired on Mass Ave, somebody shooting in the air and shooting towards a car. That subject was arrested. And on March 30th, someone pointed a gun with a laser scope, a laser pointer at a female. And yesterday, an alert officer found the car that was given in that lookout. The subject from the car approached him, and the officer had information that the gun may be kept in his fanny pack. That subject was quickly secured, pat frisked, and found was that semi-automatic pistol with a laser aim on it, a clip that can hold up to 30 bullets, 28 of which were in it, and 1 was in the chamber. That subject was secured, the weapon was secured, and he then threatened the life of 2 of my officers. So these crimes are still occurring, and they're still happening, and I just encourage, as the mayor always does, for the courthouse and the people down at court to do the right thing also. I knew there was some word about releasing prisoners in Massachusetts, but don't make a bad situation worse, please. These people need to be held in custody. The people who are staying home and abiding by what the instructions we have given do not need another factor in their lives to make them uneasy about doing so. So I asked that it was Mr. David Ballard who was arrested, and I'll let you know how bold some of them are. Prior to his arrest with this kind of weapon, he was at 130 Pearl Street trying to gain access to our lobby to bail out his brother, who was also arrested for shots fired. So there are some bad actors out there that need to be taken care of. We're on the job and we're constantly working, and I just encourage and I need the support of my judicial partners to do the right thing. On top of everything else that's going on, we're doing such a good job protecting ourselves and protecting the public with the COVID. I need judicial action to help protect us against people like this. So on behalf of, I'm sure, the mayor and myself, there's just two examples of some arrests that were violent and deadly over the weekend in Springfield. And we've done our job, so please continue to do your job. The rights of those innocent people out there to not be infected with COVID should not be infringed upon by prisoners whose rights are to not be infected by COVID. Somewhere along the line, our rights to be safe have to be placed above them. Thank you.
Thank you, Commissioner Clapper. Well put. And again, the individuals she brought to your attention are once again repeat violent offenders. And we do not want them on our streets or neighborhoods here in the city of Springfield. Made a clarion call to the court system to keep them locked up. Police have enough to do. We're doing our job. We ask you to do your job and keep them locked up. That's what I hear from every nook and cranny, no matter what creed, color, or background here in the city of Springfield. They want to continue to be safe and enjoy their neighborhood. So does repeat violent offenders. We keep grabbing them. We ask you to keep them locked up. And that percentage really is 1 to maybe 2% of the crimes they keep repeating. With that, our brave and dedicated firefighters are out there, keeping everybody safe and sound, so I'll bring up Fire Commissioner Bernard B.J. Calvin.
Good morning. Thank you, Mayor. So right now in the Springfield Fire Department, we have 5 firefighters out on home quarantine. We have 1 awaiting test results. I have 1 dispatcher out on home quarantine right now. She's awaiting test results as well. I have we're in pretty good shape as far as manpower and womanpower at this point, keeping our heads above water, doing the job every day. I have some thank yous. I'd like to first thank my command staff for the extra work they're putting in to make sure everything's running smoothly. I'd like to thank my firefighters and my officers who are coming to work every day, doing the job and taking care of everything. I'd like to thank the dispatchers who are continuing to come in. I'd like to thank the doctors and nurses at Bay State Medical Center and Mercy Medical Center for making sure our personnel can get tested and are able to still do the jobs. I'd like to thank Commissioner Clapper and her police officers for the partnership we have and the hard work they're putting in with us. And most of all, I'd like to thank the mayor for his leadership in this difficult and trying time. I'd also have some additional thank yous. MGM and the Springfield Thunderbirds fed an entire shift last week. They brought in food for one of the groups, and I'd like to thank them for providing meals for the firefighters. And also to Joe Frigo, who has contacted me and wants to provide something for the firefighters, as well as some of the hospital staff. So we'll be lining that up this week. Lastly, I'd like to thank the civilians and the citizens of the city of Springfield. They've kept the calls down. We haven't had any major fires in the last 2 weeks, which is great. because when a fire goes on, we can't social distance, we're on top of each other. So I'd like to thank them for their extra diligence in this time and making sure fires are down and emergencies are down within the city. And lastly, I'd like to thank my wife, who has been doing the extra stuff at home, because when I get home in the afternoon, I am shot. So she's been taking care of the extra stuff at home, so I want to thank her. So she got to get the extra plug in. So everybody, please keep up the good work. Keep an eye on cooking. Keep an eye on your candles if you're burning candles in your house. And everybody just try to stay safe and take care of each other. And hopefully my report next week is just as positive as this one. Thank you very much.
Thank you, Commissioner Calvi, and I'm going to follow your lead. A big thank you to my wife, Carla, and my daughters, Cassandra and Kiara. And maybe that's a sign to each and every one of you, with your significant other, your partner, your spouse, to say thank you, especially to the frontline people that are out there, because they worry about each and every one of us, and you know, we have to continue to be out there to keep everybody else safe. So we appreciate that. I'm now going to bring up an echo dev, my Chief Development Officer, Tim Sheehan, he and his staff have done yeoman work to be able to pump out, prime the pump. Our first round went out Friday, or Thursday or Friday. We're hopeful our second round of about $500,000 for small businesses, restaurants, grants. Applications will go out sometime this week. So without further ado, and I want to thank him also for his efforts with Pat Sullivan and Helen Caulton-Harris with the homeless project that we have going on Worthington Street. Chief Development Officer Tim Sheehan.
Thank you, Mayor. As the mayor indicated, on Friday, approximately 30 grant awards were made to various restaurants across the city, totaling more than $220,000. We were very pleased to see the ethnic and geographic diversity of those awards. We are in the process of completing the reprogramming process to allocate $500,000 of grant assistance to small businesses in Springfield. As the mayor indicated, we are hopeful to have that application be live by the end of this week. I think it's important to note that the intent of these grants is ultimately to allow these businesses to remain sustainable until such time as the federal funding can actually be employed by them. I also wanted to ask if any small businesses have questions with regards to the stimulus package and the various programs that are available to them. Please feel free to contact our office. It's 413-787-6020. Staff will be happy to engage with you and understand what your needs are and try to link you up with assistance that's available currently or that which might be coming in the future. Thank you, Mayor.
Thank you. Thank you, Director Sheehan. Thanks, Tim. I call him the Wizard of Oz, the Director of Facilities Management and Parks, Pat Sullivan and his team. And a really huge shout out to the park crew, to the cleaning crews that we have out there, facilities management, whether it's City Hall on the streets, and then the building, the carpenter, everybody who's doing work out of facilities management. Just tremendous when we were there Saturday morning. Without further ado, the Director of Parks and Facilities Management, the Wizard of Oz, Pat Sullivan.
Thank you, Mayor, and good morning, everyone. Before I start, I just want to give a shout out to Mrs. Sanchez. She drove by the site and just yelled out a big thank you. She works in the health industry, and she was just so impressed, Mayor, with what you're getting done on Worthington Street, and that kind of gave everyone the big push to keep going after working 12 and 14-hour days for 8 days. So we're nearly complete with 12,000 square feet of space to serve the medical teams that will serve the Friends of the Homeless population. We're ready to move into tent number 2 tomorrow. We are completing 1 and 3 today, so that the floors will be able to be painted tomorrow night. All tents have hot running water, laundry, HVAC systems with ultraviolet air cleaners on the return air, and then the nurses' stations all have the proper cleaning rooms to keep them safe. When you consider 8 days ago we had a raw parking lot and transformed the site, which will create a safe environment for both the patients and the medical staff, it's a testament to the talent of the team that Mayor Sarno has assigned to this task. First, to our trade staff, their talents have shown in this project: electrical, plumbing, HVAC techs. Our glazer, he found the needed plexiglass over the weekend, because plexiglass is actually in very short supply because everyone needs it at the registers throughout the stores. And just everyone's played an important role both on the parks and facility size. To Charlie Amet, his company has delivered the very necessary infrastructure within the 8 days. His company has installed the water and sewer infrastructure, the HVAC units, the ramps necessary for the patients to get into these tent facilities. And then to the many contractors who have answered the calls, many of the contractors kept their stores open, came in off hours to get us the supplies. So Hampden County Sheriff's Department, Hamden Zimmerman, United Plumbing, the Barnyard, Great Country Garages, Mandy's Appliance, Kelly Fredette Lumber, Mike Carabetta, Concord Plumbing and Heating, Page Plumbing. And these companies have stayed open, like I said, and really helped us meet the deadline. So also to our cabinet members, I would just want to thank you for your help and everyone within your departments: the Springfield Police Department, Springfield Fire Department, Code Enforcement, DPW, Finance, Comptrollers, Procurement, Economic Development, Department of Housing, and the Springfield Health Department. It took a lot of people behind the scenes to make all this happen, and Mayor, thank you for all your leadership during this time. Thank you.
Thank you, Pat. Thank you, Director Sullivan, and your whole team. Just tested and true, each one of my cabinet heads and rank and file. I know that Timmy had mentioned with our restaurants, there are a number of restaurants that are giving food, feeding, whether our first responders, frontline providers, medical community, and I know over the weekend I was also contacted by Andy Yee and Peter Picnelli. I think you'll have an upcoming announcement coming from those two individuals who heart and souls about the city of Springfield, about continuing to provide for medical and our first responders. On the Worthington Street site, again, a big thank you to President John Cook of Springfield Technical Community College. When I called, without hesitation, and his Board of Trustees, they're allowing us to use that area as the triage center. So to Stick and President John Cook and the Board of Trustees, thank you very much. We take it for granted. DPW, the men and women and the gentlemen, they're out there on the streets. They're picking up your trash, picking up our trash. They're doing street services, and they're keeping things going in these very challenging times. And that's under the very strong and good direction of my DPW director, Chris Signoli.
Thank you, Mayor. With regard to DPW, we are business as usual with regard to trash and recycling pickup. Tomorrow we will be starting yard waste. It's something we will be monitoring as we move through the week to make sure that we can keep our social distancing with our employees, number one, and with the residents out there. So your help in getting the material out there in the correct way will be very helpful. One thing I did want to let people know about trash and recycling, we are running routes a little differently these days, so your typical pickup that may come to your home at 8 o'clock or 9 o'clock in the morning may not be till later in the day. So please be aware we are running a little late on particular days, but it is all getting done on those days as well. Over at Blunt Park Smead Arena, last week we put out some compost material. It went very quickly. We will be putting some out over the next couple weeks as well. Again, for people who are out there, keep your distance from everybody else. We know everybody's home and you have work to do at home, so hopefully this material will help you out as well. So with regard to DPW, we are business as usual, and I thank everybody in the administrative and the cabinets who's been helping each other throughout this. So thank you, Mayor.
Thank you, Director Signoli. Chris, thank you very much. I don't know if there is an update on the legal side. My city solicitor, Ed Pakula, and my HR and Labor Director, Attorney Billy Mahoney, who have done a lot of behind-the-scenes stuff that's important when we cross the Ts and dot the Is. Same thing for my CAFO, my Chief Administration Financial Officer, TJ Plant, and his team. We are, doesn't sound sexy, but we are tracking any and all costs as first and foremost is to provide for each and every one of you, the residents and business community here in the city of Springfield. And then as we've done with other prior natural and man-made disasters, I will go after every dime of reimbursement that I get my hands on from the federal, state, and local level. With that, and again, I'm so appreciative that Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Ruse, the Chief Medical Officer of Mercy Hospital, Trinity, take the time to come here. We speak all the time, but take the time to come here on their busy, hectic schedules to be here on Monday mornings at 10:15. So if you have any questions pertaining to Dr. Kerouac and Dr. Ruse, those would be the first questions. Could you please ask them so they can get back to their establishments ASAP? And then and my cabinet heads will take any and all questions. So Dr. Kerouac, Dr. Ruse, to the media that's here, and thank you to the media for continuing to get this information out. We appreciate it.
I've got a question for the doctors.
It should be a TV show, huh?
I like your mask, Paul.
Do you have any estimate as to how many beds might be put into the Mass Mutual Center and what they would be used for? Would they be used for non-COVID patients or COVID patients?
I don't have any specifics about the Mass Mutual Center. I know in some of the other field hospitals, they've looked at 250 to 500 beds. And I think that for us, it's important that they fit into the puzzle of what we're trying to do, because if you think about this as a continuum of flow between people coming in and needing some kind of service, maybe ICU, maybe critical care, maybe routine, they then need to go somewhere after that. Hopefully they can go home, but some of them might need to, be with oxygen and supported in a kind of rehab or nursing home or a long-term acute care facility. So all of those things have to be in balance for the flow to continue, for us to not overwhelm the acute care hospitals on the front end of the whole flow.
Confident all that can come together in time?
I think that we've been able to stay ahead of it. A step ahead so far, so that every time, we've filled each one of these COVID positive patient units at Bay State Medical Center about 70% filled. As soon as that happens, we're then looking for the next unit. Where are we going to move patients to? So we've been able to stay a step ahead, and we've got about, as I mentioned, about 300 or so beds of headroom still in the big hospital, plus some smaller numbers of bed headroom in the community hospitals. Rob, you want anything else? Okay.
I don't have anything else additional.
Anything to add to that?
No.
Okay, thank you.
Any other, Audrey Russo?
I did have one question. So you mentioned the drive-by testing locations. I also heard you mention you talked about expanding your testing. What kind of patients would the drive-by or drive-through testing rather be looking to treat, help, or test?
These would be our patients who basically are experiencing flu-like symptoms and are feeling sick but aren't sick enough to be in the hospital. If they're kind of on the fence and not sure which way they would, whether they need to be in the hospital or not, if they had, let's say, shortness of breath or sustained high fevers, we have a special area in the emergency department to assess them. But if it's simply somebody with a flu that they'd otherwise feel, okay, I'm going to stay home with this and not going to go to work, those would be the kinds of folks that we would see in the drive-by centers. We may include, of course, some of the first responders from outlying areas in those areas if we can, too.
And are you able to say what locations, which Bay State locations?
We had scoped out 6 separate locations across the Pioneer Valley, but of course we can't staff them up until we have the materials that we can test with. So hopefully we'll be able to be a bit more specific about which specific locations. But if we were not limited by testing capacity, we'd have 6 open today.
Does the Bay State or
I'm aware of one place in the country, Houston Methodist, that's doing that work on an experimental basis. We are not at present planning to do that. There are some clinical trials of other agents that are being explored at Bay State Health.
And at Mercy Medical Center, through Trinity Health of New England, we are looking at potentially engaging in a trial to be able to use convalescent plasma. We do not yet have that approval, but in partnership with the American Red Cross.
Ms. Russo? One quick question. Back to the Mass Mutual Center. What is the status? Is there any plan at this point for that to come about very soon? And who would staff that?
We're really in the planning stage at this point with respect to the Mass Mutual Center. They're doing a walkthrough today to see about feasibility, how big could it be, et cetera. And really there have been no specific decisions made about who would staff it or what kind of care would be given there even. So still kind of in the early phases. Early phases doesn't mean it won't happen quickly, but it's still in the early phases. Sure.
I did want to ask about the models showing that Western Mass would have a peak somewhere in May versus mid-April. Given that Massachusetts is one of like the harder states, why do we anticipate the peak could be, or why would some estimate that the peak could be later rather than earlier?
I think that there are a lot of variables that go into these models. Some of them are how much do you think the infection will penetrate into the community? In other words, what percentage of people will end up being infected? What's the current rate of rise? What's your estimate in terms of the effectiveness of social distancing? And so as you make different assumptions about those things, you can get different looking curves. Based on our best guesses about all these variables, we're thinking that May might be a more accurate prediction. And I will say, based on what we're seeing at Bay State, that would seem to hold as well. And when I look at how long has it taken us to get from 100 to 200 cases, doubling in other words, it's closer to the sort of 7 days that they saw in some of the countries that were more effective in their public health efforts than the, say, 3 or 4 days that they saw in northern Italy.
Well, I would just echo Dr. Kerouac's comments in terms of the ways in which the model can be looked at. And our experience at Mercy has been similar in that it has taken several days in order to see an increase in cases, and over the past several, that has been fairly steady.
Yep. That's a good thing, right?
I'm sorry?
Yes.
That's a good thing.
That's a good thing.
Yeah,
we want the
absolutely.
long, slow burn instead of the big explosion.
Yeah.
And remember, one of the lines that I was taught in my epidemiology training is that all models are wrong, some models are useful. It's kind of like weather forecasting. So there's going to be something wrong about every model you put out, but if it helps you with planning, then that's a good thing.
Geez, Dr. Fauci has nothing on you.
She basically answered my question.
Okay.
Any other questions of Dr. Kerouac or Dr. Roos? Audrey, go ahead.
I have one
It's
more.
okay, it's okay, that's
One
fine.
from what I see on social media, I know a lot of people saw a report that a tiger in a zoo tested positive for coronavirus. And I think it might really nice some of the questions people have about whether or not their pets can get it or be conduits for transferring it. And I was wondering if you guys have heard of any advice coming out of that from any who should handle their own pets.
Yeah, I think your tiger, the tiger probably poses a greater threat of something else beyond COVID if you've got one in your possession. We know these coronaviruses exist in animals. That's where they started, right? Everybody believes that this current one started in bats. So coronaviruses can affect other animals. But I think the important thing about that and about, scrubbing your groceries and, hiding in your basement. I mean, just because something's possible doesn't mean it's important in terms of transmission. I think that's what you need to look at. You look at how people get this infection, and it's not like only people who own tigers get this infection, right? Or only people who eat bananas get this infection. It's basically close personal contact. So that's how you do things, rather than imagining what might happen and where the virus might live and for how long, and if it's in some animal's mouth or whatever. You look at how the cases spread, and that's where you derive your defense strategies.
Any other questions of Dr. Roos or Dr. Kerouac? Let's give them a round of applause. By the way, Dr. Kerouac, those are two good lines there. Two good, very, very comedic lines there. We could use a lot. That was very good. And Pat Sullivan, we're not getting that tiger anymore. No tiger. Okay, we won't do that. So we'll open up to any and all questions that you might have of my cabinet heads or myself. The Mass Mutual Center, again, the governor had mentioned to me late yesterday afternoon, that being looked at as a field hospital. I have to say, with what we have here in our professional ranks of healthcare providers, the hospitals, and my city team, we're ahead of the curve. We've made some moves 10 days, a week, 10 days, 12 days ago ahead of time to position ourselves if a surge is going to occur. Believe you me, we all hope that we're wrong. Because if we're wrong, that means we did our job. So again, I can't say enough about the whole team, especially my city side team, who has been tested and true through tornadoes, freak nor'easters, natural gas explosions, and now this COVID-19 coronavirus. But I don't know if you have any questions, myself and or cabinet heads, before we close up. And thank you so much for getting this information out. Yes, Paul Tuthill.
As you know, Marty Walsh last night
Yeah.
is recommending a curfew in the city of Boston, not ordering one, but recommending one. What are your thoughts about that? Do you think something like that's necessary in Springfield?
We'll take a look at everything. I'll bring Commissioner Clapprood up, but I mean, it's a big difference between recommending or ordering it. If you order it, then you can follow through with the enforcement that you have to do. Recommending it, our residents have been pretty good. It's something we strongly advise, that we've already advised, that if you don't have to go out, don't go out on that. So, but I'll have Commissioner Clapprood, if she wants to come up to address. A curfew is a very tricky thing to handle. I'm going to have her come up and voice that.
Before she does, do you think that I know the issue with Boston has been his concern with seeing people congregating in large groups that have had this issue for weeks.
Yeah.
Is that an issue in Springfield?
No, well, here's the thing. I think, Marty, they're having issues with the basketball courts. What we did, Pat, I think I ordered it well over 2 weeks ago. You can't tie the nets. They're just going to cut them. We took all our rims down. We've shut out, 2 weeks ago, we shut off all our playground areas, cordoned them off. We blockaded areas. People could still use for passive recreation, but let's say at our golf courses. So when you're going to lower the boom, you got to lower the boom, period, on it. On a curfew, they're very, very difficult to put forward and very, very difficult at times to enforce, unless it is an order. If it's an order, then the appropriate officials, in a respectful manner, the police department can do whatever they have to do at that point to save lives. If it's a recommendation, it's a recommendation. So we made these moves. Again, Springfield, we're well ahead of the curve. We're not perfect, but we've been tested and true. We made these moves some 2 weeks ago. So we've been able to control that. I think I called Pat Friday, late afternoon, early evening, that we had a call that there was some congregating going on at Blum Park. So at that time, we see the times, and we'll send the appropriate staff and or police to say that. But I understand, I know my solicitor, Ed Pakul, in our early morning cabinet head meetings indicated, because we live right near Forest Park, he was out there walking, people were obeying by everything, getting past recreation in. And again, on the masking, which I do have my face covering here, you got to follow everything, but we're recommending it. You still have to go to a grocery store, maybe a large box store, maybe even a smaller store. A lot of people are practicing the social distance, some are not. So that's just not only protect yourself, but to protect others. But I really like to have Commissioner Clapprood come up, Paul, because that's a fine line. Don't get me wrong, you know me. Law and order, compassionate, but law and order. So if I have to lower the boom, we will, but it's got to be done the right way, because if it's not, I'll bring Commissioner Clapprood up. We talked about that this morning in the early morning meeting.
We did, and Paul, right now, I would recommend to the mayor that we do not need a curfew because we have been taking the calls for large gatherings. Cruiser shows up, gets on the PA system, advises the group to disperse, and everybody's been cooperating. So as long as everybody's been good and people seem to be going by what's been recommended to them, I see no need. A voluntary curfew puts the officers in a real tough spot, you know, to get on a PA system and say, our recommendation to you is you disperse and go home, and then what happens from there if they don't. So as long as everybody's taking it serious and they've been doing what's asked of them, my advice would be not at this time. We're in a little bit better shape.
Thanks. And Audrey, before I go to you, I want to echo what Commissioner Helen Caulton-Harris said. To businesses that are not supposed to be open, don't do it. And if I hear any pouring establishments that are trying to be clandestine or a speakeasy, don't do it. And if we are aware of a couple situations, and those situations will be pursued or have been pursued, which is going to put your license in jeopardy. Giving you fair warning out there, boys, don't do it. Don't do it. So that warning's out there, whether it's a business that's not supposed to be open or a pouring establishment done in a clandestine underground type way. Don't do it. Because I'll follow all the proper procedures and I'll yank your license. Audrey.
I did want to ask if you had like a specific number, how many establishments you guys were looking at or pursuing who weren't following the guidelines?
That's for me to know and them not to, and for them not to know. We get information filters our way. And, like a lot of times what we do with the illegal dumping, with the mobile cameras we put out there, smile, you're on candid cameras. So, fair warning, boys and girls. Simple as that.
I have one more question.
Sure, come on up.
Yes.
Thank you so much. I just wanted to ask about the numbers of cases in Massachusetts over the past 7 days. Just wondering if you might be able to just discuss the curve a little bit in terms of cases, deaths versus cases versus deaths versus hospitalizations. Because I think a lot of people hear the number of just positive cases, and there is, of course, cause for concern. But what does the curve look like for those who are hospitalized, and then for those who unfortunately pass away from it? Is it still as steep as the positive cases, or is it a little bit less steep?
That would probably have been a question for the doctors. I think they're in a position to let you know how many positives, how many hospitalizations, and how many discharges there are. I think Dr. Kerouac gave us some of that data. This is very difficult to know. It does feel like a wave in terms of the way that it's projected across the Commonwealth of Massachusetts, and I really believe that Western Massachusetts is really going to see a market increase based on that wave. But in terms of the peak, it's rolling. We're not sure what that is at this point, and that's why we stress all of those prevention strategies that we're asking everybody to adhere to.
Any other questions or comments?
I've got a couple questions.
Sure, Superintendent Warwick. Any detention we might have gotten before years ago is all waived now.
Yeah, all detentions are canceled.
You need a laugh.
Well, actually, along those lines, Commissioner Wiley said last week that the state would not require schools to go past the 185-day point, but they could if they wanted to. What are your thoughts about Springfield? If we see school, going into June, July, assuming we ever get back?
No, our last day on the 185-day schedule we did was June 19th, so that's what we're anticipating sticking with.
Is it a question of cost, or what
Well, there'd be a tremendous cost if we were to try to go beyond that. But, you know, when most of your schools aren't air conditioned, the value of that action you'd have to think about, because after that it's going to get, it wouldn't be optimal learning time.
You mentioned that you were working to resolve some connectivity issues as far as sending laptops home. Do you know how many students don't have internet access, and how are you going about trying to get it to them?
No, but what we do know is that there's connectivity available in the city, and we're finding ways for each family to get that connectivity. So working through that. Working with Comcast, and also we've gone throughout the city, and it's slow, but everyone can get on with our laptops.
Okay,
Yeah.
so you talk about like
Hotspots, you know, there's a deal with Xfinity, and again, with our laptops, they can get on almost anywhere in the city.
So you think all the students that are going to have laptops, everybody's going to be able to?
We're going to work through it, and they're going to get on, yeah.
Will there still be a need to send home paper packets, or are you going to eliminate that?
We're still looking at that, but we're thinking of using the technology more right now.
And this is going to, when will this start?
Oh, no, we've been started. Our teachers are using it. You know, we had schools that were already take-home schools, and they've been using it since we've closed out. So it's just a continuance, but we're really pushing it out there hard and really working with our staff. Very proud of my staff, my senior leadership team, the way they've set up and organized this, because this is an enormous undertaking.
But you were prepared for this because you were making investment in the equipment.
We've been very fortunate, like I say, going back 5-6 years. We did a technology plan, and we sacrificed in other areas, but we invested heavily in technology. We thought it was going to be a worthwhile investment, and it's really proving to be really worthy of our investment. And again, I want to thank the mayor and the school committee, because at that time, we were cutting other things to make that investment, but it's going to be of great benefit to our kids.
5 years ago, you probably never thought you'd be using it quite this way.
Oh, no, we certainly didn't. No, never envisioned that.
Thank you.
Thanks, Paul.
Any other questions or comments? Okay, again, I really want to thank the media very, very much, getting all this information out. We will continue to do this until we starve and kill this virus, hopefully very shortly, every Monday morning at 10:15. Subsequently, if something arises that we have to call a press conference, hopefully in a more positive fashion, or if something challenging comes up, we will call that press conference together. Again, I cannot say enough about my city team, from cabinet heads to rank and file. They've done a tremendous job, tested and true. And to the residents and business community of the city of Springfield, I appreciate you and what you're going through right now, and we ask you for your continued understanding and patience. Though some of the things we've said to you are common sense and seem simple in fashion, they are important. So social distancing, please, 6 feet. Wash your hands, personal hygiene. Follow all the health requirements. Face coverings, especially, and I have mine right here, which I've worn. I took off for now. When you're going out and about, especially the larger box stores, even smaller stores not being practiced. We are in Holy Week, and I wish each and every one of your families a happy Passover, a happy Easter. Ramadan is right around the corner in a week or so, 10 days, 2 weeks. And though we might be physically away from our loved ones right now, spiritually, we're never far away. We will get through this, as I've stated a number of times, together as one and for the better. God bless you, God bless your families, and God bless our city of Springfield. Thank you so much.